Hi, I'm Hope Witkowsky, your host of Senior Scene. Most of us spend more time looking at our very special outfits, the outfits that we wear to work and the outfits that we wear for special events. We look at those little labels inside and we make sure that when we clean them, that we're going to make sure that nothing possibly bad could happen to them. But do you take advantage and do you take special care for that special outfit, your skin? Let's go visit Dr. Valentine and learn all the tips that we can do to protect our skin. Dr. Phillip Valentine is a Torrance dermatologist. He's somewhat of a skin expert, studying his patients' spots, moles, and potentially detecting dangerous signs of melanoma skin cancer.
Hi, Ms. Carlson. How are you doing?
Oh, I'm doing pretty good.
Great. Good to see you here. Oh, boy. How have you been overall? Had a good summer so far?
Yeah.
Oh, good. Did you have a good Labor Day weekend?
Right.
Good, good. How's all the family doing?
They're doing fine.
Oh, great, great. Well, it's time for our examination, of course, and we hope we don't find any melanomas or anything that looks like that. But
I keep hoping and praying you won't find them.
I know.
But you found them before.
I know. So, well, we hope this time we won't. So we're just going to take a look here. We're looking at the face here, and that looks very good. And we're coming all the way around here, and that looks good. And then we're going to take a peek inside your ear and look on the outside of it and behind it. And we're going to go to the other side as well. Take a peek here and look behind it. And then we're going to go ahead and look at your neck here on the left side and the front on the right side. Look at your chest here. And let's look at your arm.
Clara Carlson is a patient of Dr. Valentine. She's a product of the Gidget and the Beach Boy era, where silver reflectors and baby oil with a common beach accessory. Now at age 83, she's much wiser and much more vigilant about her skincare, especially after enduring 4 surgeries to remove melanoma skin cancer, first on her leg, then on her face and cheek.
When I was young, we used to go to the beach and we thought we were getting tan and beautiful, but then I get melanoma 50, 60 years later.
Clara's story of her life in the sun matches so many people her age when it wasn't known the damage that sun can do.
I have all this because I wasn't more careful probably when I was young and going to the beach and all that.
Another patient who is just getting ready to enter her senior years at age 58 had to learn the hard way that her lifestyle did to her skin.
I have been coming regularly to the dermatologist because I knew all my years of sunbathing and being fair-skinned and having moles that I knew I had to get checked out. And so when I came in, Dr. Valentine checks me, and I'm on the 6-month schedule now, and when he finds something that is suspicious, I go in, and then I have the biopsy, and then once in a while you get a phone call saying, well, something came back positive for melanoma. My first melanoma was on the top of my right foot, a place I didn't even think about putting sunscreen. But all those years of wearing flip-flops in the sun, well, that's what happens.
Who would have thought that you can get skin cancer on the top of your foot? If there is anything good to come from this illness, it's the story that Clara tells us about her son.
One of my sons is 24 years old, and he was actually in the room with me here when I found out I had my melanoma. And I remember he put his arms around me, and he was there for me. But he still thought things like that couldn't happen to him. He's too young. And he started going to tanning salon, works out at the gym, wanted to have a nice tan. And he saw what happened when I went through my surgery. And I'd also shown on Facebook, every once in a while I would mention something to him about, it's in our family, You need to be checked out. You need to be careful about this. And then one day he came up to me, and it was so touching. He said, Mom, I canceled my tanning membership.
Skin cancer doesn't discriminate. While we've only talked to women so far, Dr. Valentine sees patients, both women and men, young and old.
When it came to protecting my skin, this was in the 70s, and unfortunately at that time there wasn't really the awareness when it came to skin protection. So probably things that people do today, I was probably doing the opposite. I was putting on baby oil. I was probably not putting on anything at all. And I would be out in the beach for 8 or 9 hours. And so whether it be coming in and out of the water and reapplying, I wasn't reapplying anything. So unfortunately, I had a lot of burns. I had blisters at times. And at the time, it really wasn't something that was communicated to me that I should be aware of. And so unfortunately, I paid the price for it. I went into my general practitioner for just a routine physical, and my wife the night before had noticed something on my chest. And it was, it looked like what I had thought to be, from playing basketball, a cut. And it was a little bit irregular in skin color. It was brown. And, went into my general practitioner and asked him to take a look at that. And his comment to me at the time was very nonchalant, saying, this doesn't look like there's anything to be concerned about. And so he took the biopsy. And then I received a call 24 hours later from Dr. Valentine asking me to come in. And basically what it was early stages of malignant melanoma. And so within 3 days after hearing from Dr. Valentine, I was at Norris Cancer Center in a 6-hour surgery.
Rex Jones also learned the hard way, now as a cancer survivor. He says he uses sunscreen products with an SPF of at least 50 when spending time in the sun.
I don't take any chances. I'm always applying, whether it even be going to work or whether it be going out and coaching kids sports or whether it be going down to the beach. I'm always applying protection. In addition to, I'm wearing long sleeve shirts with ultraviolet, as well as putting towels on my legs when I'm sitting out on the beach as well.
Dermatologists recommend using a sunscreen with a minimum SPF of 30. Also, choose a broad-spectrum sunscreen that protects against UVB and UVA radiation. Also, wear protective clothing, such as a wide-brim hat and sunglasses, long-sleeve shirts, and pants to also protect against the sun. And when you're out and about, try to avoid the sun's strongest rays, which occur usually between 10 a.m. and 2 p.m. We're at Torrance Beach and talk to a surfer to see how she enjoys the beach while protecting herself from the sun.
Hello there. I just was out here seeing you come in from the ocean, and I can't even believe it, a surfer. How long have you been doing that?
I'm a water baby. I've been actually surfing for about 5 years. And I surf every day from about 7 in the morning till 10 because I don't want the sun to get on me. And don't do weekends. But yeah, I love to surf every day.
This is so inspirational. I mean, as a 73-year-old myself, can I ask you, what is your age?
Well, I am 67 years young and spent my whole life here in Torrance and know what the sun can do to you. I remember as a little girl we did iodine and baby oil, but I really didn't like the sun because I have such fair skin. So I always am covered, as you see. I always have a hat on, covered here. People give me a bad time about this a lot, but I've never had, knock on wood, any kind of precancers or serious cancers like melanoma. So okay. I believe in covering.
Dr. Valentine gives us some important information on the people who are most at risk at getting melanoma.
The risk factors for melanoma include someone that has fair skin, someone that's had a severe sunburn when they were growing up. Also, anyone that has 50 or more moles has a higher risk. Also, someone that may have atypical moles can also have a higher risk. And also with having close relatives that have a melanoma. These are all risk factors that I've mentioned that go along with melanoma.
There are 3 types of cancer that Dr. Valentine wants to make sure that we understand. And he tells us to not ignore them, but to seek medical attention.
Some people will develop squamous cell carcinoma, which is a carcinoma that can develop on the skin. It's also from sun exposure damaging the keratinocytes, and a small percentage of these can metastasize. So when you have a growth that's abnormal looking, you want to have it examined. There's also a basal cell carcinoma, which is the most common skin cancer that we see, that usually does not spread or metastasize to other body parts. And so those are the big three of skin cancers that we pay attention to.
Dr. Valentine is my dermatologist, and as a melanoma survivor myself, I get annual checkups by the doctor. While filming in his office, he saw something on my hand and diagnosed this as a seborrheic keratosis that was not a dangerous cancer, but needed to be removed. So he conducted a procedure called liquid nitrogen surgery to be done for this show.
Here we have a cryac, and this is the machine that we're going to use to deliver the liquid nitrogen. As you can see, there's a stream that occurs here. We are about to go ahead and treat this lesion. What happens often is this will burn and sting while we're doing this, but that will only last for 5 minutes to 60 minutes. And so as you can see, here's the freeze, and it's thawing out. And this will help to destroy that tissue so that it will peel off and no longer be a problem. Sometimes these lesions also will come back, and so sometimes you have to have treatment on another occasion.
And I won't lie, it did sting quite a bit, but I knew it had to be done. Leonard Herschler, who we also met outdoors, is a South Bay native and not only plays on the beach, but his work has him outdoors too. It was when he was changing his shirt that his wife noticed something on his back that she never noticed before.
I have had a number of basal cell cancers. They're the least serious. I've had squamous cell, forehead, ears, even on my lip. But the worst one, obviously, is the malignant melanoma. And that one, 2 of them on my back. And the only way that those were discovered, because I can't not see my back, is I was changing my t-shirt, and my wife, who's very skin cancer conscious also, said, you know what, that looks funny. It doesn't look like it did a couple of weeks ago. And went in to see Valentine, and you could just tell that he knew it was something, because immediately, let's biopsy it right now, we'll set you up for the surgery appointment, and then had to go to, it was at UCLA Medical Center to have the melanomas, 2 of them on my back, removed. So, and that's where I'm at this point. I still have another basal cell on my eyebrow that I'm getting surgery on that October 2nd. So it's an ongoing process.
One of our guests on today's show has had an important message that she wanted to give to you.
My message to everyone is to please go to your doctor. Ask your doctor to check you out. Make a referral to a dermatologist. Check out any suspicious or even any marks you have on your body. It's so worth it. It will save your life. I have a friend whose sister died of melanoma this past year, and if only she would have gone to the doctor sooner, she might be alive today.
Here we are at Torrance Beach, a beautiful sunny day. I hope today's show gave you the information that you need to protect your best outfit, your skin. Remember, if you see something that looks suspicious, go see your doctors. All of our people who are on our show today gave you the bad news of what happened to them. Don't let it happen to you. Remember, when you're outdoors, don't forget, wear your sunglasses. Protect your skin. Wear a hat too. I'm Hope Witkowsky, and I'm reminding you, knowledge is a powerful tool. Tune in next time for more secrets on successful aging.